Welcome back to Houston Life. You've probably heard dentists say a healthy smile starts with brushing and flossing your teeth regularly. But even with good dental hygiene, some folks are simply more prone to cavities or gum issues because of genetics. Well, the latest in dental implant technology offers a more permanent solution to help those patients. Please welcome Dr. Michel Azer from the Texas Dental Implant Center, along with his patient, Bradley LeConey. Gentlemen, welcome to you both. It's great to see you.
Eric.
Bradley, your teeth look beautiful.
Thank you very much.
And we're going to hear the story because you've only had these teeth completed within the last couple weeks.
Yes.
And they do look beautiful. How do you feel, by the way?
Oh, I feel amazing. I feel like I have my life back, actually. I just have this ball of confidence, and I just feel so good about myself. So it definitely changed my life.
You look really good. I know this wasn't always the case. You were feeling very kind of insecure. You stayed at home for many years. Let's talk about genetics before we learn more about your story, Bradley. Dr. Azer, we've heard people say, oh, I just have bad teeth. Is that a cop-out? That's a real thing, right? Genetics play a role in bad teeth.
It's true. It plays a big role. You can get two twins who are practicing the same oral hygiene, but one is more prone to decay, periodontal disease, or breaking teeth, and other is not. So it's a big factor.
And it must be important to know if you are genetically predisposed to having oral health issues because of the genes in your body, you can take a more proactive approach?
Yeah, if you start early on, you can definitely avoid it. It would take you probably more effort to get to a same place where someone who's not genetically predisposed, but you'll get there. Okay,
Bradley, tell us your story. So you've had oral health issues your entire life. What was happening?
And it was just very traumatizing. So I have two siblings, and they're around the same age as me, and we had the same oral hygiene and the same diet. And we'd go to the dentist, and they would have perfect teeth, and I would have like 13 cavities, and they would constantly pull my teeth to make room, and just it was just constantly traumatized because every time I would go, it was this huge procedure. So my whole life, I've kind of been afraid of dentists and had so much anxiety around going to the dentist, because it was such an early age that I was going through this problem.
Well, and you're not alone. We're seeing your before photo, which is not bad. Tell us how your teeth felt, though, during this time. I mean, I can imagine going in and having 13 cavities drilled must have been, as you said, traumatizing.
And it was just over the years, and my gum receding, and I was in constant pain. My teeth didn't touch, so I couldn't really chew my food. It was all on one side. I mean, there were some nights where I would literally just like hit my face because nothing would work. I would just have so much pain. And it was a horrible experience. And then it really just took away from my persona, and I didn't want to be around people anymore, and which is the total opposite of who I am as a person.
Yeah,
you know?
He's very outgoing, and very casual.
And I know we just met, but I know that you have a background on stage performing. You performed with Sia on Saturday Night Live.
Yes.
You've had some very public appearances and performances, and so little by little, your confidence kind of dwindled because you felt self-conscious about your smile.
Oh, 100%. It was just, and the things that I started loving to enjoy, it was just more staying at home and not being with people or not visiting people, and I was so afraid to smile because I felt so bad about myself.
I mean, were you going to dentists? Were you going to, like, how many trips to the dentist were you making, and what were they telling you? I mean, there had to be some explanation for why you were having so many issues.
It was probably, they told me I was past the point of no return. They told me that I didn't have enough bone to do any kind of implants. They just said, you just need to pull all your teeth and get dentures. And it was kind of, that was it. And it was kind of, nobody wanted to really talk to me and tell me what was really going on and kind of explain anything to me. It was just kind of like, nope, you just have to pull your teeth and that's it. And then when I had my free consultation with Dr. Azer, it was like, it was so informative to me, and just to tell me everything what's going on in my mouth and what he can do and how we can achieve it and how we can make it last. And he just genuinely cared about my interest in my teeth. So it was just totally mind-blowing to me. It was like the first time that I ever felt like heard and seen.
In the consultation with Bradley, I told him that his case is going to require more advanced implants, and for his age, it needs to be done the proper way, because we want it to last for him. He's pretty young. I had this conversation with him. We want it to last for 30 plus years without having to lose bone or implants.
Okay, so is this the ONEARCH procedure then? We've talked about this here on Houston Life before.
Yes.
Same thing for Bradley.
Exactly.
And explain how this works. And I can imagine finally being told by a specialist, hey, there is something that will help, is a relief. Dr. Azer, walk us through this animation.
So once we determine that ONEARCH is the good fit for our patients, we book a procedure appointment, and then at the same day that we're taking out the teeth, immediately we place the implants and give them teeth right away. And that's the main benefit. I mean, I couldn't imagine any of our patients walking out without teeth and then asking them to last for like the next 5 months without teeth.
Well, yeah, and that's typically the case in many other situations, right?
Yeah.
Where it's like, we're going to just put this temporary brick in your mouth and hope you can suffer through the next 6 months.
Yeah.
I can't believe, I mean, these before and afters are really dramatic. And Bradley, you're a handsome man. I don't think your before photo is bad at all, but the after is dramatic.
Thank you very much.
What was your impression when you saw your new smile for the first time?
It just felt like it was me. It didn't feel like it was fake at all. It felt just so natural to me. And I had to relearn how to smile a little bit because I adjusted the way I smiled, so I hid my teeth. But now being able to just smile so big, I'm constantly smiling all the time. People are coming up to me and complimenting my smile, so it's just such a difference in my life.
There is such a difference, and I did notice in the before and after photos, your smile is bigger now.
Oh,
You're
it's so
smiling.
big. It is so big. I'm so I'm so happy with it. I just feel so good about myself, and it's like finally a long time of going through all this drama and this insecurity, and then I'm finally being able to just kind of match who I am on the inside. So it feels really great.
Well, you look great. I'm happy for you.
Inside and out.
Inside and out, Dr. Azer. We're out of time, but you're a periodontist. You're an implantologist. You are a specialist, or more than just a dentist. You've gone through years of extra training, and Bradley had seen 13 dentists before he came to you. But you see stories like this every single day.
So, I mean, we see a lot of challenging patients or cases where they were told they don't have enough bone and there's no option but dentures. But I recommend to schedule an appointment just to know the options and for us also to do a feasibility study where this is doable or not.
Yeah.
The good news is that 95% of the patients who were told no are good candidates, and those 5% we still have options for them besides the ONEARCH solution, but we just need to take a look clinically.
It's incredible. All
Yeah.
right, Dr. Michel Azer, Bradley LeConey,
Yes.
great to meet you. Congrats
Nice
on
to
your
meet
new
you too.
smile.
Thank you so
It really
much.
does look so good.
Thank you.
Well, here's the info on your screen. The Texas Dental Implant Center has a special offer for our Houston Life viewers. The first 20 callers will receive a complimentary consultation after a short pre-qualification call. That consultation will include a one-on-one chat with Dr. Azer and a 3D scan and x-rays, which are a $1,000 value. To schedule your appointment, call 346-ONEARCH. That's 346-663-2724. You can also visit them online, bestdentalimplantshouston.com.